Right now, we're all stepping back
and doing what's needed
to protect ourselves, our loved ones, and our community.
But across Manitoba, healthcare workers are stepping forward.
They're risking their health to help preserve ours.
They've got our backs.
Now let's show them that we have theirs.
We may be at home, keeping our distance, but we can still show our support.
Together.
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 Every night, let's turn our province blue for our healthcare workers.
Porch lights, garage lights,
yard lights, business lights.
Order a blue light or make your own.
And let it shine for all to see.
COVID-19 is here, Manitoba.
And so are we.
Stay safe.
Stay safe.
Safe.
stay strong.
Strong.
Strong. Strong.
And turn our province blue.
To thank our healthcare workers.
And all those working to keep our community safe and moving.
We're in this together, Manitoba.
Good afternoon. I'm Brent Rusin, Manitoba's Chief Provincial Public Health Officer. Today there are 2 new cases of COVID-19 to report. Total number of cases is now 275. Total number of COVID-related deaths in Manitoba remains at 6. As of this morning, 5 individuals are hospitalized and there are none of those are in ICU. 220 individuals are listed as recovered and we have 49 active cases. Yesterday, 424 lab tests were performed, taking our total to 24,723 tests. We've increased our testing capacity, and now any symptomatic Manitoban with respiratory symptoms are eligible for testing. So symptoms include cough, runny nose, sore throat, fever, and so even if they're mild, to call Health Links, and they'll direct you on how to get tested. Yesterday, we announced our plans to gradually reopen the economy and to allow some businesses to reopen, but with restrictions. And so it's an important message to continue to convey that this is not a return to normal. Manitobans' commitment and hard work has flattened our curve and allowed us the opportunity to slowly roll back some of these restrictions. And so this is a gradual lifting of restrictions. It is certainly not a directive. Businesses and professionals will consult and make their own decisions on when it's safe for them to open. But certainly we feel that given the guidelines that are set out, this is a gradual and safe return and reopening of our economy in a very safe and structured format. Manitobans still must take precautions. This virus is still circulating. Manitobans are very astute now at social distancing, and businesses that are able to reopen will have strict guidelines that they need to follow to ensure that social distancing continues. What's very important, again, is one of the most basic things of all of our strategy is to not attend work, to not go into public if you are ill, even with mild symptoms. Certainly call Health Links if you're ill for further advice. Keep in touch with your healthcare provider. If you do need health care, certainly our healthcare providers, it's safe to attend them. It's safe to attend for urgent and emergent issues. It's safe to contact your healthcare provider and to attend if care is needed. But we still need Manitobans to take precautions. Still be mindful of social distancing. This is not a return to normal at this point. If we continue to function the way we have been, we'll continue to decrease the transmission of this virus in Manitoba, which will allow us to further loosen some of our restrictions. Right now, staying home with your immediate family is the best way to protect yourselves and the people around you. We have not seen significant community-based transmission or outbreaks in personal care homes at this point. Our healthcare capacity has continued to increase, and so this sets us up for this gradual reopen of our economy. But we'll follow these numbers very closely and very cautiously. Businesses that have questions about the new orders can visit engagemb.ca for further information. Continue to access our website, manitoba.ca /COVID-19 for up-to-date information. So once again, thank you to Manitobans for your efforts, and thank you for your efforts going forward. And I'll pass it over to Lanette.
Thank you. Good afternoon. My name is Lanette Siragusa from Shared Health. I'm the Chief Nursing Officer. I want to acknowledge that it is a strange and uncertain time as our province goes through this COVID-19 pandemic, hard on families and everyone. For most Manitobans, that means stepping back and keeping their distance. But for healthcare workers, for first responders, and for essential workers, it actually means the opposite. It means stepping forward to keep us safe and to keep our communities functioning. So we are asking everyone to shine a blue light to show their support for these workers. Whether it's in our home, our yard, or our business, we can acknowledge the efforts of our very dedicated teams and boost their spirits. So more information can be found on truebluemanitoba.ca. And we're also encouraging everyone to share their blue light photos on social media using hashtag HealthcareHeroesMB. I would also like to provide some statistical updates on a few items. In the past week, HealthLinks has received nearly 8,100 calls. The average daily wait time varied from 2 minutes to 4 minutes. Our online assessment tool has seen 460,000 web views since it launched more than a month ago, and that includes approximately 20,000 in the past 7 days. DynaCare continues to call patients who are COVID negative, so I guess they're not patients, the negative tests. They made 3,112 calls in the past week, and since they took on this task in March, they've made nearly 19,000 calls to Manitobans. So as a reminder, if your test result comes back positive, Public Health will be contacting you immediately to give you instructions on what to do and walk you through that process. With regards to the personal care home staffing, there is a public health order that will take effect tomorrow for all licensed personal care homes within the province of Manitoba. This order and our preparations to implement it are in response to the potential but significant impact that COVID-19 could have on our long-term population, long-term care population. We spoke earlier this week about the sobering statistics across the country that show that over half and sometimes up to 80% of the COVID deaths are residents of long-term care facilities. And it is important for all Manitobans to know that we are starting at a very different position than other provinces. We have 127 licensed personal care homes that are regulated and licensed by Manitoba Health. And as of March 12th, Manitoba personal care homes were up to date with the required 2-year licensing process. All complaints and investigations were also up to date as of March. So now work is underway to restart these processes immediately. The public health order requires staff that usually work in more than one of Manitoba's licensed personal care homes to only work in a single site. And this has been a monumental task to plan over the last few weeks, and a significant amount of effort has gone into ensuring staffing stability and continuity of care. So I want to sincerely thank the operators of those personal care homes, the regional leadership who is supporting as well, the Long-Term Care Association of Manitoba, and the Manitoba Association of Residential and Community Care Homes for the Elderly, and to everyone else who's been involved in this planning from an operational and a human resource perspective. I am pleased to share that as of this morning, 121 personal care homes have plans in place to implement the single site staffing restriction starting tomorrow. There are 6 remaining sites where we continue to work with our provincial human resource and operational teams to address some staffing challenges. And for staff who would normally work more than full-time across multiple sites, HR options are being finalized to ensure that they are able to work those hours up to a maximum of 1.3 EFT at their assigned location. So our focus will be to continue on ensuring stable PCH staffing. Staffing resource pools are being developed. Casual part-time staff who wish to work more at their assigned site can certainly talk to their manager to look at what those options are. And retired or former staff who want to work are encouraged to contact our provincial recruitment and redeployment team or their college, especially if they're nurses. And this is not just for the PCH planning, it's also for as we look to ramp up acute care in the future if need be. So this is an important step in our ongoing efforts to protect our most vulnerable populations as Manitoba begins to see some of these restrictions lifted. The visitor restrictions will remain in place for the time being, but we will continue to regularly reassess the situation as we see the results of the broader testing and of the return of some of the activities in our communities. We really do understand the important role that families play in the health and well-being of our long-term care residents. However, we must continue to be vigilant, preventing this virus from entering our personal care homes. I also want to announce that a new testing site is opening tomorrow in Swan River, Manitoba. This is Manitoba's 16th community testing site and 9th drive-through location. It will be located at Manitoba Public Insurance's facility on 4th Avenue North. Hours of operation are 10:30 to 3 p.m., 7 days a week. And as a reminder, our testing criteria has been expanded to include anyone who's experiencing cold or flu-like symptoms, such as fever, cough, running nose, or sore throat. And finally, I just want to speak to the emergency department wait times. So we have seen a significant reduction in patient volumes at emergency departments and urgent care centers throughout Manitoba in the past 2 months. In Winnipeg, between February and March, there was an 11% decrease in patient visits to emergency departments or urgent care. And preliminary numbers for April suggest that that downward trend continues on. So there are several factors likely at play that have led to this decrease, but we do want to make sure that people who might be wary about seeking care due to COVID-19 are not stopping a visit from a healthcare facility if they need to be there. So healthcare facilities have implemented measures to ensure the safety of patients and staff, including strict visitor restrictions, enhanced screening for staff, social distancing measures, and upgraded cleaning procedures. So I do just want to let everyone know that the hospitals remain open to serve the public, and anyone who has an urgent or emergent health concern should not feel the need to stay away. And with that, we can open the line to questions.
Thank you. A reminder to our reporters online, this afternoon we're going to start with just one question each, and then we'll see how the time unfolds. From the Brandon Sun, Bud.
Yes, Bud Robertson at the Brandon Sun. Just want to get a thought from Dr. Rusin regarding all symptomatic patients or people being able to get tested. I'm sure there must be people who are thinking, well, I have some symptoms. They're mild. They're not going to do anything. There's no treatment, so why bother being tested? Can you speak to why people should bother being tested even if the symptoms are mild?
Technical adjustment, thank you. Bud from the Brandon Sun, if you could re-ask your question, please.
I will do that. That's for Dr. Rusin. Just regarding all symptomatic patients, people, whether or not all symptomatic patients, even if their symptoms are mild, just a thought of what you should tell them. Like something they say, well, I have mild symptoms of this. However, they're not going to treat me. They're advising us to stay home anyway. Why should I bother to get tested?
Right. So a couple things with that. One is if we get tested, then it also allows for contact tracing. So if we have a positive case, then we can also go and follow up with all those contacts to ensure that they are going to self-isolate and get tested should they develop symptoms. The other thing is if you were mildly ill and you felt you didn't have a number of contacts, if you stayed home for the 14 days, then again you're doing your part to protect Manitobans. So most important is to stay home when you're ill. But right now we're still, there's a lot of benefit to detecting cases, and one of those benefits for sure is being able to contact all of your contacts.
From CJOB, Diana.
Good afternoon, Diane here from 680 CJOB. Dr. Rusin, my question is on campgrounds. Is enforcement going to be stepped up at campsites now that we know that those are going to be open? Will we be seeing extra officers out, especially during the very popular May long weekend, for example, just to make sure that everyone is doing things appropriately?
Yeah, so certainly the rules apply there, and there's a strict guidelines, and so enforcement is certainly possible, and conservation officers are able to enforce this. So certainly we know Manitobans are well aware, and by far most Manitobans have been following advice, and so very likely we're going to see that as well. But in those rare circumstances where enforcement is necessary, then certainly it's possible there.
From the Winnipeg Sun, Scott.
Hi, Scott Billick from the Winnipeg Sun. Just going back to the WHO released their statement today about people, encouraging people to come to ERs. Do you know at this point of any severe outcomes in terms of people's wariness to come to an ER or to come to an urgent care facility when they haven't? Has there been any numbers tracking that sort of thing?
I don't have any of those numbers, Scott, but it just I think it's just in the effort of being cautious and making sure that if there are people who are at home and thinking that maybe they shouldn't come because it's unsafe to come, there's some situations where it's unsafe not to come. So it would be, it's just hypothetically, we want to make sure that people know the doors are open and we're there to serve.
From CBC Radio Canada, Laisa.
My question will be for Dr. Ruston. Regarding the reopening of the economy, there's some people, there's some entrepreneurs that are saying that it'll be very hard for them to reopen because to respect the protocol, they need to have things like sanitizer, mask, or gloves, which are really hard to find now. What are you answering to them? And in the province, is there anything that you are trying to maybe ordering more masks, making sure that those people that will want to reopen the economy will have access to?
Right. So, so certainly it's important that this is a lifting of restrictions. It's not a directive. So we're certainly not directing anyone to return to open their business or to do anything. This is a lifting of restrictions. And so, the guidelines are set out. We think it's the right time. We think if the guidelines are followed, this is a safe and cautious approach to it. For certain of the professional organizations, we're going to engage. But again, the worldwide demand on personal protective equipment is large right now, as you can imagine, and so we need to ensure that we have enough supplies to provide to our healthcare workers on the front lines. But there is going to be some engagement in that regard. But again, this is a easing of restrictions, not a directive in any way. And so, but we do think it's a safe time and it's a safe plan.
From CBC Manitoba, Bart.
Hi, Dr. Ruston. In Saskatchewan, they're telling dentists they should not drill unless they're doing so in a closed room that's vacant for 2 hours and clean before the next patient. Why are you allowing drilling in Manitoba? And in your medical opinion, is it okay for dental offices to be doing that work that involves aerosol tools?
Right. So this is a thing. So we are easing our restrictions, but we're not directing the professions of others. So we can certainly be engaged. We can certainly work with those organizations to decide on how they feel best to practice within their profession. But it's, it wasn't for us to direct them on what procedures that they should or shouldn't take. So we can engage, we can be there, but again, this is a loosening of restrictions. It's not a directive for them to begin that. It's just that we've felt it's time that we don't need to restrict the activities of professions and those regulatory bodies. They will decide how best to do their practice.
Steve, sorry about that. From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Ruston, I know it's hard to outline details for every possible scenario and every type of business, but just a few days away from the opening, some businesses are wondering, well, exactly how much hand sanitizer do I have to have on hand? Who has to wear a mask? Should I make everybody wear a mask? The distancing through aisles that may converge, is that a problem? With short notice, and I know it's not a forced reopening, but there's competitive pressures there that would maybe nudge a business to open. What do you say to those businesses that say, well, there's a lot of the nitty-gritty details here that I'm not really clear on?
Yeah, a lot of those are provided in our document that's available online, manitoba.ca COVID-19, that will outline a lot of the things that are required. So certainly masks in the typical retail businesses are not mandated, but they're certainly can be used as an additional activity. Physical distancing is a requirement, and so we need to ensure that there certainly is not prolonged close contact with people, that 2-meter distance. There's guidelines on occupancy, so most retail businesses will be required to have 50% of usual occupancy, or one client per 10 square meters. So there are guidance on there. EngageMB.ca is another avenue if they have questions. So there is guidance out there, and on how much a company will need, that's not something that we could direct. There's such a myriad of practices out there. But I think those questions just demonstrate that Manitoba businesses know how important this is. They know how important it is for this to go well. Because we do not want to be rolling back this loosening again. So everyone needs to take caution. Everyone needs to protect themselves and the people around them. This is not a return to normal. This is a very gradual and cautious return to some economic activity.
From CTV Winnipeg, Michelle.
Hi, it's Michelle from CTV in Winnipeg. I'm wondering about, can you just explain the rationale for the province's decision to allow partial openings of patios where there's physical distancing for gatherings up to 10 people, but you're still advising against going over to visit somebody at a private home or preventing them to go see family and friends in the hospital?
Yeah, so again, it's a lifting of restrictions. So it's not necessarily a changing of our advice. This virus is still circulating. And so there was never a restriction that could prevent people from going to visit family members. It's just Manitobans knew the importance of trying to stay home as much as they can. They knew that depending on how much contact you may have had, then having close contact with others could put them at risk. And if those others are people that are already at high risk, then that's something that Manitobans have avoided. So we felt it was a good time to be able to loosen some of those restrictions. And in places like restaurants on patios, we know the transmission of this virus is much less likely in outdoor places. We have that 50% occupancy rule, so social distancing will be in place. And so Manitobans need to, they're aware of this, and our numbers have demonstrated that, the precautions that Manitobans will take. So this, again, isn't that return to normal. This is the gradual reintroduction of economic issues here, but we would still need to be cautious. We still don't want to see increased transmission of this virus, and close, prolonged contact can do that.
From the Winnipeg Free Press, Carol.
Good afternoon. It's Carol Sanders of the Free Press. Dr. Rusin, from day one, you've had really consistent messaging about being cautious, and it was cautious messages that you were giving. But the reopening for Manitoba that was announced Wednesday was broader than any other province, and there was very little lead time for businesses, the public, and public health officials to prepare for it. Was it your advice that a broad reopening plan was all doable as of May 4th?
Yeah, so I think our advice right from the beginning is that we needed to take extreme measures to limit the impact of this virus in Manitobans, that as soon as we are getting indications that we could loosen some of that, we would. The lead time issue, again, goes back. This is not a directive to anyone. This is just a loosening of our restrictions. Anyone can take as much time as they feel that they need before they can do anything with the loosening. So we weren't too concerned about the lead time. Certainly public health is well prepared for this. We knew following our curve, and we knew right from the beginning we had plans in place on what we would do should we need to loosen these restrictions. So I think if we look at our curve, if you look at our numbers, it's a safe time to do this. It is a broad reopening, but it's also very restrictive. The restrictions on these businesses that are opening is significant, and that's because we're not returning to normal. We're just doing this slowly. We're going to follow these numbers really cautiously, and we have the ability to roll it back if we need. But I think everyone realizes how important it is for this to succeed, and that way we can continue to loosen our measures even further.
From Global, Will.
Good afternoon. This is Will from Global. Dr. Rusin, campgrounds on the list of businesses that are allowed to operate again. I'm wondering if you could just provide us with some clarity on and maybe some examples of measures that campgrounds are expected to take to keep people safe, and perhaps what campers could do as well.
Yeah, so again, this is right back to our basics. So nobody who's ill should be leaving their house. other than for healthcare. The physical distancing. So it's going to be expected that there's not going to be groups greater than 10, and that physical distancing is going to be respected the entire time. And so these are the type of issues. And so, outdoor environment for the most part is somewhat protective against transmission of the virus. I wouldn't suggest groups of people go camping that aren't part of the same household. And when you do get together with other households, then physical distancing should be respected. And even better, it should be in outdoor places.
Thank you. We do have a few more minutes, so if there are other questions our reporters would like to ask, please proceed.
It's
Lanette here from JOB. For Lanette Siragusa, apologies. With respect to those personal care homes, you mentioned obviously 121 are good to go as of tomorrow. Is there any sort of specific part of the province that they're maybe seeing a bit more challenges with trying to restrict those workers to the one facility?
Well, they're going to work through it today, so I hope by the end of today we'll have resolved those existing challenges. I think in some of the rural areas there are a bit of challenges in terms of maybe not as much agency staff available, but we are working together from a provincial approach and are going to make sure that we support each other to support those residents.
Yes, Lanette, it's about on the same subject. Regarding personal care homes, are private personal care homes under this umbrella that you're speaking of, and are they all on board and ready now for this?
Private and licensed personal care homes would be included, yes, and they have all received communication. I believe they've all been speaking with their staff and are getting themselves organized, yes.
Thank you.
Dr. Ruth, I'll start with you here. Can you get into the rationale behind day camps but not schools?
Yeah, so I mean, I think that the day camps there, we're able to limit the numbers quite a bit. So the same as in daycares, we're going to limit to 16. So it's a little bit difficult in schools to do a limit like that. So that was some of the thought there. We wanted to have some outlet for these day camps. A lot of this is going to be outdoors, which again protects against transmission. So that's the rationale, and just sort of the logistics of returning hundreds of thousands of kids in a short period of time to school versus somebody operating a day camp can play a role as well.
Dr. Reese and Scott Bill from the Sun here. A lot of questions coming yesterday after wanting to know about the mass gatherings and churches wanting to know if they can congregate before that September thing, if that number of public gatherings goes up and what constitutes a mass gathering. Goldives are wondering if they can hold games, if they can ensure social distancing at the ballpark, that they fall under that. Can you provide some clarification on that?
Yeah, so again, looking forward, it's difficult to know where we're going to be in September. The issue with the mass gatherings, especially indoor events, this is where we've seen some of these what we call super spreader events at weddings, at church, at funerals, even indoor restaurants. This is where we've seen those large events. And so, outside passing by someone, very unlikely to transmit. Casually walking by someone at a retail outlet, especially with physical distancing, is less likely to transmit. But these gatherings, these large gatherings, indoor, prolonged gatherings, that's where we've seen these super spreader events in many jurisdictions. And so that's where we're going to be very cautious with this. And so that's why we haven't changed the 10 rule at this point. We're going to look at that carefully and try to expand that as possible. But right now we need to be really cautious with those type of gatherings.
So would that apply to like Goldives or something like that too? I mean, those are outdoor events.
Yeah, but really large events with many people. These are, again, even though it's outdoors, that's putting us at risk. And so again, we're reviewing it. It's tough to know where we're going to be months from now. But it is something that we're going to look at, and just like what we're doing on Monday, we're only going to leave these restrictions on as long as they're needed to protect the health of Manitobans. As soon as we get an indication that we can ease again, we're going to do so.
Dr. Wilson, what do you say to
I have a
people who
question regarding the daycare situation. In the plans presented yesterday, the daycare situation was not that clear. What are you planning to do? When is the daycare reopening? And also, let's say if I'm a business that is now that I can now function, as a parent, can I put my child in a daycare that we're considering for essential workers?
Right. So the the daycare is returning to normal. That's not decided yet when that's going to happen. It's not going to be happening in this phase. They're still restricted in size to 16 in licensed daycares and 8 in home daycares. But the move is to allow anyone who is returning to work to have access to childcare. That's been expanded.
Dr. Rusin, what specific advice do you have for businesses and workers who are too scared to reopen or go back to work?
Yeah, well, I think it's to look at what we're saying here, the numbers that we presented, that Manitoba has flattened this curve, and that we're going to be dealing with this virus for quite some time. So there's not going to be a time when this virus is just gone in the foreseeable future. So we can't be in a position to have these restrictions on for a year. We have to look at ways to safely do this. And right now, looking at the numbers in our community, we feel that this is the time. But again, like I say, it's not the return to normal. We have a lot of restrictions, a lot of safeguards in place, and with those followed, we think this is a safe reopening, and we actually, think that we're going to be able to loosen restrictions more in the upcoming weeks if we can maintain our focus.
Question for Lanette, Diana here from CJOB again. As far as the elective surgeries back on the agenda as of Monday, is there any procedures that are still not happening these days?
Well, it's really up to the individual surgeons to assess on a case-by-case basis. So I wouldn't make the generalization that no procedures, any procedures are excluded. There are some that are more elective than others, but sometimes the elective cases need to get done as well. So really, I think most of them are on the table for consideration, but it's up to, we haven't for sure gone up to our full capacity yet. We would like to work our way towards that in the coming weeks, and as we are prioritizing what needs to go next, the surgeons will really have to have the conversation with the patients and then work with the facilities as to how they schedule as soon as possible.
Thank you.
I'm wondering about will healthcare staff from long-term care homes be allowed to work in hospitals as well, or is that limited to?
Yeah, that's a really good question, Michelle. So this is quite a monumental task that we've never taken on before in the province. So there were hundreds of staff that we need to look at just within the personal care home. But I think it's worthy of a discussion that once we start with personal care homes, so the order restricts people from going from one personal care home to another personal care home. But we do need to look at staff who maybe are working in home care or in acute care and look at what are our options for that to minimize travel and spread of the virus. So that's for future consideration, but we just needed to really start with this point right now.
As well, do you have any concerns about the opening from a board for businesses about whether or not they would be able to plan, that people might be scrambling? I know public health is very cautious and very prepared about issuing plans and looking at. I'm just wondering, did you have any concerns about this plan coming out 5 days after it was being announced, that there wasn't enough
lead time or for this to sink in, really, for people to prepare? I know they don't have to open on May 4th, but like Steve said, there is a lot of competitive pressure. Wouldn't it have been better to maybe announce this for a week ago or announce the reopening for a week from May 4th and not do it so soon?
Yeah, so remember that there's been a lot of engagement with the business community, throughout our plans to see what businesses could do to protect against the spread of the virus. So there's been a lot of engagement through, and certainly some of the things that you bring up has come up to give more lead time, but it also came up just as strongly, and if not stronger, that every day counts. And so some businesses, they felt that the soonest that they could open up, the better for them. And so that's what we came up with. And so we think we got a safe plan. We had a lot of engagement with the business community, and again, it's an easing of restrictions, not a directive, but there's been engagement all along.
Thank you, everyone, and this concludes today's media briefing.